Oh, right here?
Right here?
Well, yeah, because I'm going to want you two to be like you are. And let's bring Sue right in. What? Double chins out. Okay. Okay, everybody.
I have been able to, through the TAM program, and I really feel that they've saved my life. I mean, without TAM, I don't think I'd be here.
I just couldn't imagine what my life would be like without going to the TAM program.
The TAM program will change your life, and what you learn in the TAM program, you'll be able to take with you for the rest of your life.
Hello, I'm Bill Clements, and 6 years ago I was diagnosed with serious coronary artery disease. As a result of that, I discovered the TAM program. So today I eat well, I exercise great, I use stress reduction techniques. My cholesterol levels are very low and completely under control, and the best news I ever hear is at my checkup when my cardiologist says, "That is the sound of a healthy heart." This is the program we'd like to tell you about today. I'd like to introduce you to the director of the Marin TAM program.
Hi, I'm Vicki Chase, a co-founder of the TAM program. The TAM program is a comprehensive lifestyle management program designed to reverse the process of coronary artery disease. We've been working with individuals for over a decade, and our data shows that it works. Whether you have heart disease or are at risk for heart disease, working with us in the TAM program decreases your chances of having future heart problems.
I had extremely high cholesterol, extremely high blood pressure, obesity, completely sedentary lifestyle, and TAM made huge changes in my life.
Probably one of the best things that happened to me with TAM is it got me into an exercise program that I religiously did.
In the TAM program, you receive personalized fitness plan to maximize the benefits of exercise. Our specialized staff of exercise physiologists and nurses coach you throughout the program workouts.
The exercise was something that improved, and I noticed when I was in the TAM program with the exercise how all my numbers changed. I had actually had to drop my thyroid medication because I had worked out so much that I didn't need it.
What I really liked about the TAM program was the nutrition portion.
Nutrition is a critical part of risk reduction and heart disease reversal. TAM participants meet for meals with our registered dietitian. Each participant receives an individualized computer analysis and nutritional consultation designed to lower their cholesterol, reduce hypertension, and obtain their optimal weight.
And after a while, I found that I was liking the things that I was eating. Sometimes I'll have a meal with just a vegetable. Now, back in the old days, that would have been unheard of.
I don't eat a whole lot of Indian food, but I do once in a while. But I'm pretty careful what I eat. Watch before not, but now I just want to make sure I put what I put in my body to make sure it's good enough.
It taught you about portion control, what the right things to eat, even told you when you go out to restaurants that you can go out, you can enjoy yourself.
The stress reduction portion is probably, for me, one of the most important aspects. My job and life is rather stressful. I travel a lot.
I think more and more women, you know, as we're in the workforce and we have the stresses of raising kids at the same time being, you know, kind of head of household, I think we have more stress, and possibly that's why you're seeing more of us with heart disease.
Yeah, come back nice and slow. Right toe turns in.
In the TAM program, we utilize several methods of stress management, including Tai Chi, Feldenkrais, awareness through movement, meditation, and guided imagery. Research has shown that the body's reaction to stress is a risk factor for heart disease.
It taught me all kinds of methods to offset stress, but more importantly, it really taught me how to identify it. So I could be working and suddenly around 11:30 or 12 start feeling not anything big, but feel the stress. I could feel it in my body and know that what they taught me is you have to stop it right there.
I think that the main points that you learn in TAM is that you don't have to keep things only to yourself. I think that you are in a group of people and you work with them and you become friends with them and you share their pain and you share their concerns and they share yours.
The group sessions are great. I mean, in fact, one of the reasons I came back to the TAM programs was specifically for the group discussions. They're very supportive and you learn a lot from other people's experiences.
I had some reservations at first about being in a group. I don't like being in a group unless I'm leading the group. And initially, the first couple days, I had some judgments about people, and then to my pleasant surprise, I found that the judgments went away after the first few sessions, and I actually grew to really like everyone in the group.
It's a great program. Bringing the children in for the support group and just everything that the TAM program offers is life-saving and life-teaching.
After going through the whole thing, I found that there was no BS, and it really didn't all click for me till the end of the thing. I found out how it worked. It worked for me. I'm still alive. I'm sure partially because of that.
I'm Dr. Mark Wexman. We started the TAM program more than 10 years ago in order to provide a comprehensive plan for coronary risk reduction. For the first 5 years of the TAM program, we tracked the case histories of more than 100 patients with known heart disease.
Was that a stress echo she was going to have you do? Did she mention?
We found a dramatic increase in survival rates as compared to patients treated with usual medical care. We found TAM graduates needed fewer coronary procedures, had better lab and cholesterol numbers, and reduced their overall cardiovascular risk. We believe our comprehensive program not only serves patients by preventing second cardiac events, but also works as a primary prevention strategy for those who have risk factors but no demonstrated clinical illness.
I did not have any reservation about the cost. I did not want to do this again. I did not want to go in the hospital. I did not want to be catheterized again. I did not want to have angioplasty again. So I didn't care what it cost.
I can't put a price on my life and my future happiness, and TAM has made it so I have a future life and future happiness.
Well, you can say life, money. I mean, you can't spend money if you're dead. So, it is a big, it's a commitment and it's something that people need to budget for. But it's so, as the MasterCard commercial says, some things are priceless. This is one of those things that are priceless.
So now we've given you a brief overview of the TAM program and what it's done for its graduates. I know personally it's one of the very best investments I have ever made. My family and I believe I'm going to be around for a long time. And what more can you ask than that? While no one can predict the future, practicing the lessons of the TAM program can really help you take charge of your health. If you have heart disease, if you're concerned about heart disease, if you're at risk for heart disease, we urge you to contact us. Please use the number on the screen or on the video cover. We would really welcome your participation in our program. Thank you very much.